I am going to welcome everybody to this morning's Age-Friendly Live event. My name is Leonid Lenny Orlov. I use he, him, his pronouns. And today we're going to meet Jorge Madrazo and Dr. Jerry Garcia from CIMAR as we get ready for National Hispanic History Month that's starting later in the month on the 15th. We'll also get an update on COVID-19 from King County, Seattle Public Health. Actually, it's going to be from me, but the information is from Public Health. And we'll hear an update from our partner, the Seattle Public Library. But before we go there, what I would like to do is to acknowledge the indigenous land that the city of Seattle is on. At the City of Seattle Human Services, we acknowledge that we are on the traditional land of the first people of Seattle, the Duwamish people, past and present. We honor with gratitude the land itself and the Duwamish tribe. Please visit www.duwamishtribe.org to learn more about the Duwamish people of the inside who are still here and find out how you can get involved. And we thank you very much. Next, I want to talk a little bit about housekeeping, introduce today's moderators, and one of our moderators today, our guest moderator, Pamela Mascara. You can't see her right now, but you can see her picture on the screen if you're joining us online. She'll read the questions in Spanish and translate for our audience. Thank you, Pamela, for doing that. Also in the studio on Facebook, if you join us that way, we have Justin England. He'll put in some links and also interact with you there. And folks you may not see today, but their pictures on the screen are Michael Taylor Judd, Meg Wolf, and Gira Hammam. And one thing that I always mention before we get started is that you may have questions that go beyond what's being presented here today. So for that, there is a network of organizations which CIMAR is a member of, and it's called Community Living Connections. There is a website that you can go to, communitylivingconnections.org, where there's a map actually that shows where these organizations are in your community. Or you can call the 1-800 number and find out where to get services and resources such as food, meals, etc. And that number is 1-844-348-5464. We'll be adding this information in the various chat windows we're using today. We do stream twice a month. Close to Home Stories of Health, Tech, and Resilience does have a sister program, which is called, I guess it's the older sister. It's the Civic Coffee Hour, because the Civic Coffee Hour has been around for over a decade, unlike Close to Home, which started early on in the pandemic back in 2020. So on September 16th, we will be checking in with Andres Mantilla, Director of Seattle Department of Neighborhoods. You will learn what SDOT is doing to help Seattle become more age-friendly and have an opportunity to ask your questions about that department's operations and how it affects your life. It'll again be available with all the translated captions, and you can find the login information as usual on bit.ly/age-friendly-live. Each word is capitalized, and the call-in numbers will be available as well. In general, age-friendly is this aspirational model of making cities more livable, better places to grow up and grow old, and certainly Department of Neighborhoods and organizations like CIMAR, they contribute a whole lot to making that happen. And so we're very fortunate to have them here. We're also very fortunate to have the support of the Seattle Public Library. starting in 2020 on all of these events. And I know library is working really hard on getting open as much as possible and providing services even while all the buildings were closed. So each time we've had an update from the library, and today is not an exception. Today on the show, we will be welcoming Nancy Sloat, who is the older adult program manager at the Seattle Public Library. Nancy has been an amazing partner for us over, I can say the years, plural now, because it has been a couple of years. And we look forward to a lot more moving forward. You know, when we are able to be in buildings, and even if it's limited capacity, maybe we can go the hybrid model. We'll see. But what's happening today at the libraries is the topic. So Nancy, you're on. Please take it away.
Thank you so much, Lenny, and good morning, everyone. So I am the older adults program manager at the library, and I work on programs, I create programs, and I work on services to make the library more age-friendly and accessible to everyone. So it's a great place for me to work. So on these programs, I'm able to give you a short update on what's new at the library and maybe highlight some services that are, you know, not so well known, which I like to do. So before I start, I just wanted to also say my appreciation for our partnership with Age Friendly and Seattle Aging and Disability Services for working with us and allowing us to work with you to bring these programs. So could I have the next slide? So yes, we have 24 branches open as of yesterday. The newest branch just opened yesterday, September 1st, was the Montlake branch. And just in general, book returns, you can return books anytime you want into the book drops. Masks are, per all the public health guidelines, have always been required in the libraries themselves. Can I have the next slide? So I always like to highlight the newest branches that come on, and Montlake literally just opened yesterday, and look at those. It's open Monday through Thursday and Saturday and Sunday as well. So Montlake is one of my favorites. I'm a little biased because I was the manager of that branch for a number of years, but it also has my favorite piece of artwork in all of the Seattle Public Libraries. And the slide is showing a piece of artwork, the one that's got the colored globes in it. And that's actually called Skylight Aperture Sundial. It's done by a local Seattle artist named Rebecca Cummins. And you can see that it has 5 circles that are cut into the ceiling with colored glass on them. And what happens is they project a series of these colored spotlights that move through the library as the sun moves across the sky, or appears to move across the sky. And basically, you'll be able to mark the position of solar noon, right, between the spring and the autumn equinoxes. And it obviously changes as the days move forward. So it's a very cool art piece. And so just go, if you're interested in it, go to the Montlake branch when it's sunny. Doesn't work when it's cloudy. So anyway, it's a really fun piece of artwork. Can I have the next slide? So we have even more branches opening in a couple of weeks. Some of our smaller branches like Wallingford, September 13th, and Madrona on September 15th. We're also working on increasing hours and days at all of the branches. We now have a bunch of branches that are open 7 days a week, and a number of libraries that are open 2 evenings a week as well. So we've increased them to 8 p.m. Could I have the next slide? And because our hours keep increasing and days sometimes change, definitely check in with your local branch to find out what the hours are, or you can go to our website and read that web address, spl.org/road to reopening, all one word. Or you can call our quick information line, which is 206-386-4636. There are people on the phone who are incredible. They know an amazing amount about the library, have incredible knowledge. And sometimes I even actually have to call quick information because I can't find something sometimes on the website, or I need clarification of something. And of course, if it's a reference question and I'm stumped, I have hundreds of colleagues who can help me. That's what's so wonderful to work in the library. So can I have the next slide? We are doing right now a survey in the libraries. It's online, or you can pick up a paper copy in a branch. We are in the midst of doing a search for a new chief librarian. Our old chief librarian, Marcellus Turner, left earlier in the years to take a new position. And our board of directors, which are 5 people appointed by the mayor, are responsible for finding a new chief librarian. They're doing a survey from the community and through organizations about what people are interested in sort of the qualities of a new chief librarian, and what are the most important things for a new chief librarian to be working on. So it's just a couple of minutes survey. I did it yesterday as a staff person. And it's right on the front page of the library's website. And or you can actually pick up a paper copy if that's easier for you. Could I have the next slide? So here's one of my favorite services at the libraries. And now that the buildings are open so much more, you can take advantage of our collection called Peak Picks. I think this is the most popular collection that we have. So basically in the Peak Picks collection, there are very high interest, newly published titles, ones that have a whole number of holds on them already. People are really interested in getting these books. And it's nonfiction, it's fiction of all different genres. And we purchase hundreds of copies of these books because we really want to get them out to people, because people are really interested in them. There's a special display in every library. And so the unique thing about this is those copies, you can't place holds on them. This is all first come, first serve. And it's really fun. You walk in to a branch and you go, I've been waiting to read that book, and you just grab it. So another difference is that these books, when you check them out, only check out for 2 weeks rather than the more typical 3 weeks. So you got to read fast. Don't grab too many of the Peak Picks. That's what I do all the time. And then they kind of sit there, and then I need to return them. But anyway, have fun with this Peak Picks collection. Could I have the next slide? And for those of you who have come to some other programs, I keep talking about our adult summer reading program. We call it Adult Bingo. And it's coming to an end, but you still have time to fill in your squares and get your cards submitted for drawing for prizes. So basically, it's 25 squares, and each square has a different type of book to read, like a book that made you laugh, or a book that takes place in an Olympic city, or a book on activism or social justice, or recommended by a librarian or a bookseller. The card comes in English and in Spanish. And we have book suggestions and title suggestions for each of those squares if you go onto our webpage. And then once you fill in and get a bingo, or go for the whole thing and do a blackout, you can submit your card for some great prizes. Here's a recommendation from me if you go to the next slide, because of course I'm a librarian and I like recommending books. So I just read a book called Under the Harrow. It's a psychological thriller, and I love those. And basically, I couldn't figure out who the murderer was. Every character could have been the murderer. So I think that was a really successful book, and it does fit a couple of categories: recommended by library staff, recommended by a friend, mystery or crime, and even an Olympic city host. So have fun with that one. And librarians and staff can recommend lots more books for you. Can I have the next slide? So we have a terrific program coming up, something that I've loved to work on this project. We've been doing a project with Seattle older adults and Singapore older adults to explore their experiences during COVID through art and through teaching artists. And we have a public program coming up where all the people who've been participating will be talking about their experiences and showing what they've created, creating a cool public program. And we're going to actually be streaming that live on Facebook as well. So if you go to the library's calendar, library's webpage, you can find information about registering. Can I have the next slide? And coming up, I've talked about this before, but it's so important. We have a number of programs coming up about Medicare. The open enrollment period where you can change your plans is coming up starting in October. So this is a great time if you're interested in information about Medicare and want to know a little bit more about the ins and outs to come to one of our programs. In September 25th, we have a program in Mandarin, and on September 28th, we have a program in English. So please go register through our webpage at spl.org/calendar. You'll find all of the programs of the library. Can I have the next slide? So I just want to invite you to visit the program pages that highlight our older adults programs at on the library's webpage. You can get to it directly at spl.org/nextchapter, one word. We call our program Next Chapter. You'll find all kinds of resources and links to organizations that can be helpful to you, and book lists and blog posts, and of course all our programs. And then finally, the next slide, the last slide. I just wanted to invite you to contact me if you have any comments, any ideas for programming. I would love to talk to you, and my email address is nancy.sloat@spl.org. So thanks. That's what's happening at the library the last couple of weeks. Thanks all.
Well, thank you, Nancy, for this update. It's so exciting. I heard some of the library branch names that I wasn't expecting to hear because I know they're smaller branches, and I'm glad you've gotten around to those, like the Wallingford one, for example. That's about the size of a living room, almost, but it's going to be open, and that's so great to hear. And you know, do let us know when those nice spaces for events open up. We'll keep our ear to the ground on that one, right? Yeah.
Yep, we're working on it. Yep.
So thank you for staying on, Nancy, if you can, in case there are questions. Let me actually check in with my moderators. Are there any questions for the library right now? Because we actually have a few minutes to take those. Okay, I'm getting a signal that we do not. So Nancy, maybe we will later though. So thank you for staying there in the green room. All right, in the virtual green room. See you later.
Bye.
Bye. So thank you again to the library for your support and for what you do in the community and for being age friendly. That's what we're here for, and we really appreciate you doing your part and being very cheerfully engaged in that process. Before we move on to our main event, to our two wonderful speakers from CMAR, the reason Close to Home started was to give a platform for community leaders to connect with folks that are staying at home. So the whole idea of being close to home, and part of it was updates on the pandemic as it's happening now. And so this information that you see on the screen, if you join us by phone, I'm just going to kingcounty.gov, then I'm clicking on COVID-19 at the top of the page, and then next, if you scroll down just a little, there's COVID-19 data dashboards. And actually, these are specifically key indicators. And as we look at the graph here, it shows a 7-day average, and you can see that there's definitely a spike, not quite like the one we've seen in December 2020, and it was headed that way, but now it kind of stalled out. So that's good news. But the part that I wanted to share with you that is not necessarily the best news is that percent occupied by COVID-19 patients in area hospitals, and that's on the trend up, and it's something that is concerning to health officials in the county and state. Um, you know, what does that mean for King County? The King County is supposed to be the most vaccinated county in the United States, and it is. I think it's over 70% of King County. These bullet points are from our friends at King County, and unfortunately, despite that, hospitalizations are rising pretty steeply with if there's almost 600 new COVID cases daily, you can kind of expect that considering how transmissible Delta variant is. And what we can do about that, and of course the Hospital Association is sounding alarms. You see the statistics at the bottom there. People are so much more likely to test positive, and actually the incidence of dying from COVID is, it says here, 67 times more likely for people who are not vaccinated. It's astounding. So what can we do? What we can do is we can encourage our communities, our friends, to get vaccinated, because even though you probably hear a lot of talk of breakthrough infections, those do happen, but the experience of somebody with a breakthrough infection versus somebody who wasn't vaccinated could be vastly different. It could mean serious health consequences. And I just heard this morning a study came out that the long COVID is 50% less likely for people who do experience a breakthrough infection. So something to think about, and we do want to provide information. And if you know somebody in your life or yourself who has not yet had an opportunity to receive the vaccine, which are free and available, you can call the 1-800 number, 800-525-0127. That's the Washington State Department of Health helpline. They can talk to you about vaccinations and side effects if you're concerned about those, and where you can find a vaccine near you. If you prefer to text, you can text the short number 438-829. That's actually set up by the CDC. And that will and you have to put in your zip code, basically. That's all you have to provide. And then it'll reply to you with 3 to 5 locations near you that not only offers vaccines, but also has them in stock. And I mean, in most cases, those will be the same. So these are the ways. And of course, you're welcome to go to King County's health website, which you can find just by going to kingcounty.gov. And then following the links. Just a reminder that everybody is also encouraged to wear face coverings. Masking is now required in indoor settings, regardless of vaccination status, and that includes our schools that just recently reopened in Seattle Public Schools, excuse me, and will be reopening in other districts as well. We all know in schools, social or physical distancing is a little bit trickier, but in settings where you can physically distance, that is certainly recommended regardless of vaccination status or masking, just because of how highly transmissible the Delta variant is. And as we mentioned on our previous program, the vaccinations are currently only available for people 12 years and older. 5 to 11-year-olds are projected sometime this fall, and then 6 months to 4 years in sometime in 2022. And there will be a requirement for all state workers, and that includes educators, to be vaccinated by October 18th, fully vaccinated, which means getting your second dose and then that two-week period. So that's an FYI as well. So this is what public health is doing to combat this. And using these mitigating factors. So we hope that you if nothing else, check this information out. There's a lot of good FAQs that that answer some questions and maybe address some of the concerns you may have about this process. with that, I do want to welcome to the stage and introduce our first presenter, Jorge Madrazo. So Jorge began working at CIMAR in January 2007. Prior to joining CIMAR, he worked for 6 years as consul of Mexico in Seattle. Previously, he worked in Mexico as a public attorney, chairman of the National Commission on Human Rights, and as Mexico's Attorney General. And he was born in Mexico City, earned his law degree in 1977 at the National Autonomous University of Mexico Law School. He has written 5 books and many articles on constitutional law and human rights. They have been published in Mexico, United States, and Latin America. Jorge, so good to have you here. I really appreciate what CIMAR is doing as part of the Community Living Connections Network and in general in the community. Please take it away. Let me know when I should go to the next slide. And for those of you who are watching on Facebook and on Teams, please put in your questions for Jorge so that we can pass those along. And a reminder, you can ask your question in Spanish if you prefer. Thank you, Jorge.
Thank you very much, Lenny, for your very kind words of welcoming and introduction. We really appreciate it. We are very honored with your invitation to be close to home, to your homes and our homes. It's a great honor. And I will share this presentation with my dear friend and colleague at CIMAR, Dr. Jerry Garcia. He's an extraordinary scholar, and he will be taking care of the Chicano culture explanation. So I prepared something very short, only 6 slides, and Lenny will help me to put those slides on the screen, about CIMAR in one hand and the connection of CIMAR and the Latino community in the other. So why don't we go to the first slide, please, Lenny? Here you see that the foundation of CIMAR is 1974. This is really a mistake. The legal foundation, the creation of CIMAR, is 1978. Nevertheless, all the efforts to create CIMAR started in 1974, 1975, but those efforts were crowned in 1978 with the opening of the first clinic of CIMAR. And the initiative, the idea to create something to serve especially Latinos, came from a group of activists in the University of Washington, healthcare activists. And they are the founder fathers of this organization. I'm sure that Jerry Garcia will invite you to the Chicano Latino CIMAR Museum here in South Park that explains precisely all of these efforts of this group named Los del 68, those from the 1968. So I think that you are invited to visit this first museum connected to the Latinos, explaining the Latinos in all the Pacific Northwest. Let me say something about the name of CIMAR, because there are a lot of confusion. People always connect CIMAR with the ocean. And actually, it's not connected to the ocean. We are close to the ocean. But it's the first 3 letters of the 2 cities that were the first clinics of CIMAR. SEA for Seattle and MAR for Marysville. Because again, the first 2 clinics of CIMAR operated in these 2 cities. But the very first one started here in our neighborhood, the beautiful South Park. As you probably know, South Park is the extreme south of the city of Seattle, is the area with people with the lowest income and high criminality rates. This is our neighborhood. We love our neighborhood. We spent around 1/3 of our lives in South Park. So South Park is our heart. And we are a community health center. Actually, we are a federal qualified health center. And the idea of health centers is very old. Actually, it was part of this beautiful dream, beautiful project of President Johnson, named the Project for the Great Society and the War Against Poverty. Those were the days, my friends, of Medicaid and Medicare and the expansion of Social Security benefits. One of those elements, precisely during the 1960s, during the civil rights movement, was precisely the creation of community health centers. The first one in Massachusetts, 1965, and 1 year later in Mount Bayou, Mississippi. And the idea came from a very distinguished physician, actually Nobel Prize winner, Dr. Jack Giger. Giger died last December, 94, 95 years old. And he spent some time in South Africa, working very close to the Zulus. And he took the idea of the community health centers from the Zulus, and he proposed that precisely to the President Johnson administration. And the idea, the original idea, the model, is to serve the communities, the underserved communities, vulnerable communities in a comprehensive manner. That is, not only with the medical needs, or dental or behavioral, but also social needs, education and housing and cultural barriers and languages. That is the idea of a holistic approach to the patient or individuals. That is the very DNA of community health centers. And we in CIMAR develop that idea every single day. Can we go to the second, please? CIMAR today, in a nutshell, we have around 100 points of service, including 33 medical clinics, 21 dental, 28 outpatient behavioral. We serve in 13 counties in Western Washington, all the way in the border to Canada, in the beautiful city, the small city of Everson. But if you drive all I-5 to the limits of the state of Washington with Oregon, you will find the last clinic in Vancouver, Washington. And we have other services in Eastern Washington, limited services, but we have housing, affordable housing in beautiful Pasco, and we operate a radio station in Granger, very close to Yakima. So we are all over the state. Today we are 2,700 employees, and significant thing is that 45 of all CIMAR employees, we are Latinos, 36% Caucasian, 7% Asian, and 5% our African American brothers and sisters. Next one, please, lady. You can see here in this slide the number of encounters that we had last year. 1,625,879 encounters, medical, dental, and behavioral. So yes, we are big and growing. The number of unduplicated patients or clients is more than 300,000. Today, 44% are Caucasians, 35% Latinos, 5% African Americans, and 4% Asian. And you will see the level of income. We are serving precisely low-income families. 52% at or below FPL, 19% 101 to 150, 5% over 200, and 18% we really don't know. Because we never ask for this type of immigration documents for our patients. We are committed to serve every single person that knocks our doors daily. And we serve them the same day. We have a lot of walk-ins because we are open precisely to these people with special needs. That is the CMAR DNA. Next one, please. Let's see something about COVID-19. We cannot ignore this horrible pandemic that all the humanity has been suffering. But in this area, CMAR has developed almost 50,000 tests of COVID-19, and the number of vaccines, the doses that we have offered, that we have served, is almost 250,000 for a community health center. So a lot. And we are doing every single day more efforts to reach the communities. You see the breakdown of the people with the vaccines. Caucasians 50.6, Latinos 31.7, Asian 11.5, and African American 3.3. And I'm totally sure that my friend Jerry Garcia will share with you the new initiatives that we have to reach the Latino community, because Latinos have been disproportionately affected by this horrific virus. So we are always developing new ideas, thinking out of the box to reach them, to convince them, and to vaccinate them. This is our main goal during the last 2 years. Next, please, my friend. We are connected to the Latinos. You saw that the number of Latino employees. We provide services in English and Spanish, even English and Russian and Ukrainian, because we have newcomers in that south part of the state of Washington. So we provide not only services to the Latinos in English and Spanish, with a cultural component. We understand the Latino culture, and we speak to the patients in beautiful Spanish. So this is something very unique for CMAR. Our mission statements state that it's a community-based organization specializing in the service to Latinos. So Latinos is a big component of our daily work. You know, Latinos today, this is the 2020 census. We are in the beautiful United States of America, 62.1 million and counting. And we represent almost 19% of the total population of the United States of America. And this is really very significant, this next line. This is 2020 census. Latinos account for over 1/2 of the US population growth from 2010 to 2020. So do your math. You just imagine what will be the power of Latinos, let's say, in 20 years. Because they are already US citizens. They are going to vote. They are going to vote. And we will change many things in this country for the good, always for the good. So the growth of Latinos in this last decade, it was 23%. Nevertheless, we are on this concept that the 2020 census used, well, the census doctrine, named hard to count. There are a lot of undercounted with the Latino community. Just remember what happened during the 45th Federal Administration of the United States, and that so-called question of citizenship in the census questionnaire. We were blessed that the Supreme Court declared that that question will not be part of the questionnaire. Nevertheless, a lot of people became afraid and concerned about that possibility. Even with that, we are 16.1 million Latinos counting. Okay, and let's see what happened with the Latinos in close to our homes. Please, the next, Lenny. So in the state of Washington, we are over 1 million. We are the largest minority, not only in the nation, but in the state of Washington. And in our city, beautiful city of Seattle, we are 6.7, but in King County, we're almost 10%. So we have a lot of our communities, our Latino communities, living in the metropolitan area of Seattle, but not in the city limits. And again, Latinos is an underserved community, underserved in terms of education, in terms of health, in terms of economic development, in terms of housing. So a lot of needs. That's why we are here. Those are our challenges. So thank you very much for giving us this opportunity to pass our ideas, our thoughts, our feelings, our commitments. And from all of this huge Latino community, in the state of Washington, 8.5 out of every 10 Latinos are originally from Mexico. But that will be part of Jerry Garcia's explanation. What is the connection between Mexico and Chicanos, and what Chicano culture represents today in the Evergreen State? So thank you, and brother, the floor is all yours.
All right, thank you so much, Jorge, for your presentation. And as you mentioned, we will be joined by Dr. Jerry Garcia in just a moment. I did want to remind folks out there to keep putting in your questions and comments. I believe there is a comment that came through there, so I'm gonna invite Pamela to the stage to say it. And please put in your comments and questions. You know, in Spanish, if you want. That's something that we are able to provide today. So Pamela, you're on. What was the comment there in the Q&A?
Yeah, thank you, Lenny. So this is a comment from Christy, appreciating Jorge's passion while presenting. Also a former CMARC client myself. I thank this organization for everything they do for the community.
Oh, okay. Well, thank you very much for the comment. And let me say something that I forgot. Is the connection with ADS and DSHS. Since the very inception, I would say one of the oldest CMARC programs is precisely with the elderly and disability Latino communities. We run with ADS proudly our community living connections. We are serving our Latino seniors in 14 senior centers in King County. And we can do that because we have as our golden partner, the ADS. So thank you very much indeed. We really appreciate it.
Well, we appreciate you being in the network for sure. And I was, pleasantly surprised to hear that you're doing services in Russian. That warms my heart. That's my people. And I used to work for an organization in a network, Jewish Family Service, and we served people of all backgrounds with with a focus on the Jewish community, of course. But we they certainly resettled refugees and things like that. So it's an amazing network. Thank you for mentioning it, and we love to have you in the network for sure.
Visit us, Lenny, in the Vancouver area, the different clinics that we have in Vancouver, Washington, and you will see that connection.
Very cool, very cool. Pamela, is there anything else that's come through so far?
Oh, okay, so it's also from Christy, and she's just translating, but she's saying, I'll read it in Spanish and then I'll translate it, but she's saying, gracias por su pasión para servir a la comunidad. Cuando llegué a este país, CMARC fue mi primer punto de partida. So Christy is saying, thank you for your passion of serving the community. When I arrived to CMARC, it was my first point of connection to the community. That's it.
Thank you. Thank you very much for the comment. And I would say passion is part of my temperament. It's part of my character. It's my DNA. I cannot see world in a different manner.
And it's coming through very clearly. I really appreciate your style of presentation. I think our viewers are as well. Jorge, for now, I'm going to, and Pamela, thank you for your participation in the Q&A as well. I'm going to close your microphones for now and invite to the stage Dr. Jerry Garcia. Let me look for Jerry here in the virtual green room. Oh, yes, here we go. Except what I need to do is his microphone is separate. But while I look for his microphone, I do want to remind folks that we will have a question and answer period at the very end, where both Jerry and Jorge will be on the stage, and we'll answer your questions and take your comments. All right, so here's the introduction that I have for Dr. Jerry Garcia, who was born and raised in Quincy, Washington, to parents who worked in agriculture most of their lives. Dr. Garcia received his BA and MA at Eastern Washington University and PhD in history from Washington State University, WSU. As Vice President of Educational Services, Dr. Garcia oversees the new CMAR Chicano Latino Cultural and History Museum. Dr. Garcia also oversees, as well as promotes and advocates for educational opportunities for our Chicanx and Latinx community. Dr. Garcia had nearly 20 years experience in higher education with academic appointments at Iowa State University, Michigan State University, and Northern Arizona University, and as director of the Chicano Education Program and the College Assistance Migrant Program at Eastern Washington University. Wow, quite the list there, Dr. Garcia. We really appreciate your time and really look forward to the information that you have for us today. The stage is all yours. Please take it away.
Okay, well, thank you very much, Lenny. And Senor Jorge Madrazo, thank you very much for your very powerful presentation today. It's always enjoyable listening to you hand out excellent information on our community and of course, CMAR Community Health Center. So thank you very much. And there'll be a little bit of kind of an overlap in regards to what Mr. Madrazo provided, especially in regards to some numbers in regards to the population. But I'm going to focus in on today on some history and culture in regards to the largest Latino group in the United States who are of Mexican origin with multiple labels that have been given to them over the last 170 years as part of the United States. But I'm going to primarily use the term Chicano, Chicana, to identify people of Mexican ancestry in my presentation. Lenny, can we go to the next slide? I'm very happy you got my PowerPoint. I was wondering about that. So we definitely got it. The best place to start are the origins, right, of the Chicano community here in the United States, and I'm going to bring it on down to Washington. But we all have similar origins. It's our indigenous background. People, I mean, unfortunately, I don't have a lot of time to go into a lot of the labels and their meaning and their origins and what they mean to people who identify as Hispanic or Latino or, like myself, Chicano. But people who do identify as a Chicano here in the United States are actually saying that they are indigenous because the term is indigenous. And so many Chicanos in the United States identify as indigenous people, right? First Nation people that were intersected, of course, with the European invasion and conquest of the Americas back in the, beginning in the 15th century and then, of course, the 16th century. And so we have kind of a very complex background that includes multiple intersectionalities of different groups. But when we look at the origins, indigenous in the beginning, and then it intersects with the Europeans because of the invasion and conquest dating back to the colonial period, and so we have then this long, again on my bullet point there, this long colonial period that lasts for 300 years, and that's a very important period. It's often overlooked. It's often bypassed, and my belief is bypassed because it's a very complex 300 years, and it's I like to say that you really have to know your history to be able to explain these 300 years, especially how it impacted Chicanos and Chicanas in the United States, because what we know today about Chicano, and I'll even say Latino, right? Because some of the information I'm providing here in this presentation does impact not only Chicanos but also Latinos in general, right? And so then what I'm referring to is in this, what we know today as Chicano culture and history, or Latino culture and history, in many ways, in combination with the indigenous past, is a result of this 300 years of colonial rule by Spain and what we know today as Latin America and the Caribbean. And of course, when Spain ruled this area via conquest, it was known as New Spain. And of course, Mexico was part of this empire that Spain held on to for 300 years. So just imagine, 300 years, imagine that number. That's longer than the United States has even existed. And so, so what you have to think about is what transpired in those 300 years. Well, everything, right? From the change in language, clothing, culture, the mixing of people, right? So we have so many things that transpired in those 300 years that at the end of it, in the 19th century, you have a vastly different group that emerges from there, right? So these 300 years are so vital to the understanding of Chicano history, the Chicano experience today, right? Because we still feel the impact of that time period in the contemporary period. And so one of the things I want to allude to here real quick, and then I'll give you some more definite information, is, when I talk about mixing, right, the movement of Europeans over here, overwhelmingly male for the first 150 years. And so we know right away the mixing of indigenous people with Europeans occurred primarily first through rape and violence. And so we have to understand that was the mechanism that was used in regards to this, what we call this miscegenation, or this mixing, is that the European Spanish people that came over, raped women and pillaged and burned. There's no other way to put it. We don't sugarcoat this history. We tell it the way it actually happened. All right. So, and that was the pattern that we would see throughout the Americas, right? But the result of that, right, beyond the extreme violence that was occurring, is that you have the emergence of a different group of people out of this mixture that we know in our history. We use a term for it, and it's called mestizos, right? Individuals that were half white based on their European ancestry and half indigenous. Now, when we look at this early history, it's one of those very ambiguous things to examine, is that we know that at the onset of this conquest and the rapes that were happening, you certainly had this kind of 50-50 split. But as you move into the future, in multi-generations, then that mixing is very dramatic, because then you got the introduction of other groups, primarily Africans, coming into the Americas as slaves, but also as part of the conquest. We also can't forget that Africans that came to the Americas early on in the conquest were not slaves. They were, like the other Europeans, conquerors. But then we got the introduction of slavery into the Americas, and there we're going to have additional mixing. And then you're going to have Asians coming over. Then you're going to have Middle Easterns coming over. So you got a tremendous mix ongoing in the Americas in this 300-year time period. And that's going to cause a variety of groups. And, one of the things that just give you a little nugget here, so can't get into it very, very much. But there's what's happening in Latin America during the colonial rule by Spain has a lot of commonalities with the British Empire and their colonization of what we call today the United States. But there's also some differences, right, that's occurring. And one of those differences is how they look at various groups and the idea of race in the Americas. Where in the United States, when you look at the history books, primarily what you're going to see is a kind of black and white binary that's being used to explain race relations in the British colonies, and then even to the United States period. But in Latin America, it's very different. It's kind of a multiracial state, not with equality though, because there's definitely not that, but there's definitely kind of a recognition that various groups are emerging in this 300 years because of this mixing. And so that's just a little bit of the commonalities and differences that's occurring between various empires that are coming into the Americas and pillaging and burning and conquering throughout the region. Then we had this, after the colonial period, we had this Mexican period, when Mexico gains independence, which we're going to celebrate here in a little bit, starting September 16th. It's kind of overlaps with Hispanic Heritage Month, which runs from September 15th through October 15th. But we also got the independence of many Latin American countries that we're going to be celebrating here pretty soon. Then, of course, we have, my second to the last bullet there, the forced incorporation of Chicanos through conquest by the United States. And these are our first Latino group, right? So when we use this kind of umbrella term, Latinos, we're talking about, people from all over Latin America, Colombia, Argentina, Guatemala, El Salvador, Puerto Rico, Mexicanos. But the first group that was brought in through conquest were people of Mexican ancestry, Chicanos. And what we today call the American Southwest was, of course, Mexico's northern territories. So in this war, an invasion by the United States, they ended up taking nearly 51% of Mexico's territory. So what we know today as the American Southwest, of course, was once part of Mexico, leading up to the Mexican-American War that ended in 1848. Okay, and then of course, when we have that history, right? And here, in the last 10 minutes, I've given you nearly 500 years of history really quick. And here we got another important benchmark in the Chicano history and our experience at Chicanos United States, because now we're no longer part of Mexico. Now we're part of a new country known as the United States. And again, there's going to be kind of an intersection and disruption of what was originally, right, indigenous history. Then we got mixed with the Europeans, Spanish colonial rule. Now we're getting mixed up with the United States, a different group, a different era, and a different empire, right? So this leads us essentially to where we are today. From 1848, the incorporation of Chicanos, fast forward 170 years, very much like what happened in the colonial period, a lot of things have happened to Chicanos from 1848 to the present, right? We can talk about mixing, we can talk about language differences, we can talk about assimilation, acculturation, all that has happened. And that's what makes the Chicano and also Latino, because here Latinos also, all Latino groups face this element. We all have gone through a tremendous amount of assimilation and acculturation as being part of the United States, which means then that our culture of origin, no matter where we come from in Latin America, here specifically, I'm talking about Mexico, the origin of Chicanos, then our culture of origin is going to be changed and mixed with what we call mainstream U.S. culture. But simultaneously, you still see elements, right, of original Mexican culture alive and well in the United States for a variety of reasons. One reason is because Chicanos have maintained strong elements of their culture of origin being Mexico. But the other one is because, as Jorge was alluding to or talking about specifically, the movement of Mexicans into the United States is the longest held movement of any group on the planet. We've been coming to the United States either through force and conquest or through immigration for over 170 years. So that means then, unlike a lot of groups, our culture remains alive and well because it's renewed every single day, every single month, every single year through the movement of new arrivals into the United States from Mexico. And of course, you can also say that with some other groups, right? But because this is the longest held sustained movement of any group on the planet from one location to another, that's why our culture has not only grown so much, our population has grown with it. And it's also why we have become so visible in the United States. But with that comes a lot of other issues that I'm going to have to say that for another presentation. Lenny, next slide, please. So here then, I just want to give people a little bit of taste of what I was talking about there's different ways I could have done this. I could have used language. I could have used, for example, there's this kind of this history known as the Columbian Exchange, right? During the colonial period, in which there were many things in the Americas that did not exist until Europeans arrived, and there are many things in Europe that did not exist until the contact was made with the Americas. And of course, maybe it's not obvious to everybody, but we can use maize, right? Corn. Corn is indigenous to the Americas, and we spread that throughout the world after the European invasion and conquest. Or, one of the ones that I like to mention is the horse, right? Not indigenous to the Americas, right? Also, for example, the chicken, not indigenous to the Americas, right? So it was brought over through invasion and conquest, and that contact that we're talking about, or that mixing. So the mixing happened not only biologically, it also happened in regards to language, in regards to foods, in regards to other forms of culture, right? Here, though, I want to mention real quickly is that one of the issues that we still face at the global level is this is not just indicative of the United States, but at the global level, we're still struggling with this idea of whiteness, white supremacy, and white privilege. And one of the reasons that is happening at the global level, because Europeans conquered throughout the world, not just in the Americas. So wherever you had indigenous people, they're invaded and conquered by Europeans, and whiteness then became kind of one of the guideposts for those societies. The same thing happened here in Latin America, places that we call Mexico, Bolivia, Colombia, Puerto Rico, etc. And this is again, these images, this is artwork that was created during the colonial period. For Europeans, not for the Americas, because Europeans were curious about what was happening in the Americas. So artists would come over, and especially in regards to this mixing that we were talking about earlier, this mixing between a variety of different groups. And this is where we get, the reality is that there was a very multiracial state in Latin America where many groups mixed, right? And I gave you kind of the baseline for some of that mixture, right? And here's the rest of the baseline. The Pinocelares are individuals who were born in Spain. They were given a different name. Criollos are European Spaniards, but born in the Americas. And there's a difference between their whiteness. The Spanish crown divided these two groups because those people that were born in the Americas, theoretically, when you look at them, they look exactly like people from Spain. The only difference is that they were considered suspect because they were not born in the motherland or the homeland in Spain. So they were given a different name and secondary to anybody that was born in Spain in the Americas. And then you had the mestizos that I was talking about, then indigenous people, and then Africans at the very bottom of this baseline hierarchy that was created to separate and provide privilege to those at the very top, right? So here then we got one of the earliest versions of what we call whiteness and white supremacy emerging in the Americas. And this was duplicated and replicated throughout the world. So this is why we still struggle today, because the idea of whiteness and white privilege was planted very early in the Americas. It just wasn't known by that back in this time period. But when we look at it in hindsight, this is where this idea incubated and germinated over the next 300 years. And by the time we get out of the colonial period, this idea of whiteness is well embedded. And so the idea then of the United States being this very racist country based on whiteness is not unique to the United States. You can go into many places in Latin America, and they have the same kind of ideas of revolving around whiteness. And all you got to do, and Senor Madrazo can verify this, is just look at Mexican television, and they separate a lot of actors based on the color of their skin in regards to what kind of roles they're going to play. And the same thing happens here in the United States. So here then, this is where this began, right? These are actually known as casta paintings or cast paintings. Hundreds of them were created for a variety of different groups. And this is just two I'm going to show you. My next slide is going to give you the full flavor, but I'm not going to go into it. I just want you to get a visual of what we're talking about when I say a multiracial state emerging in Latin America. So here it is. Right? And this is abbreviated. 68 different categories have been chronicled. Here, I think I got 16. Right? So this is, again, this is part of that history that's very, very difficult to navigate because in the end, we have to look at ourselves as a society. and we have to recognize what was going on, that is still taking place here in the United States and throughout Latin America and throughout the world for that matter. But these are the different groups. I got 16 in regards to this mixing that's going on. And when you understand these categories, what's actually happening in these categories is a whitening process based on the idea of whiteness. So nobody wanted to, during this time period, or maybe even today, nobody wanted to go backwards. Nobody wanted to become darker person. Everybody wanted to become whiter. And how do you do that? By mixing with somebody who was white, right? And this is that process here that I'm talking about in this slide. Lenny, next slide. So now, getting back to the contemporary period. And so here then, based on the 2020 census, are the 10 states with the largest Latino population in the U.S. So Jorge alluded to this. I wanted to kind of just give you a visual. Washington didn't make it in the top 10. We're number 13, though. If you look at the very bottom, we got the 13th largest Latino population in the United States. So when we look at the Latino population, getting back to the numbers that Jorge gave us, 62 million, roughly about 65% of all those Latinos are people of Mexican origin. And the history I just gave you tells you why, right? It's because we were part of what we call now the United States, but it's also because of immigration, but also because of birth rates, right? Chicanos and Latinos in general have the highest birth rates because we are the youngest population in the United States. And so a lot of the women, Chicanas and Latinas, are at that childbearing age. And so we're reproducing at very high rates, plus the movement through immigration. And then going back to the origins of how we were incorporated spells the population that we have in regards to people of Mexican origin. Okay, next slide, Lenny. So here we've come down to Washington State, right? And so one of the things I want to briefly say is that if we go back to that map, and you don't have to move it, Lenny, just think about the map that I just showed you. Chicanos, Latinos are the largest underrepresented group in the United States, right? But that wasn't always the case. In fact, for most of our time period with the United States, we were relatively small up until the 1980s, right? And come to Washington here, our population is a microcosm of what has happened to the United States in the last 25 to 30 years in regards to the movement and growth of the Chicano Latino population. So what we see in Washington happened at the national level. There's a strong correlation, right? So that's why, I mean, we all know there's 50 states in the U.S. Number 13 is relatively up there. I mean, there was a time where the Latino population in Washington wouldn't even break in the 30 range, right? But that was number 13. And again, there's not enough time for me to go into all the nuances, but I will tell you one thing, and this is a national trend. It also happened here in Washington. That is because of the availability of work, and here in Washington, the development of agriculture exploded in the 1980s, right? And then we also have Latinos in general going into other occupations that are more indicative of the urban areas, like here in Seattle, construction, hotel industry, landscaping, etc. Right? Those are universal jobs for Latinos, but it's also very urban. In Eastern Washington, heavily agriculture, and that's where a lot of Latinos work in. And so here then we got the populations, roughly what Jorge provided us today. A little bit earlier, in 2020, we represent about 13.5% of the total population of Washington State, which is over 1 million people. And that's dramatic, a dramatic change. And I'll give you one number at the national level. So here today, as Jorge was telling us, we are almost 19% of the total population of the United States. We go back to the 1970s, right? When the organization that we work with was barely emerging, right? Back in the 1970s, Chicanos represented maybe 6% of the total population in the United States, right? And that's kind of pushing it a little bit, right? So today we're almost 20. So it's an amazing difference. And if you were to extrapolate the percentages and growth there, we're in the 100% ranges, right? 200 to 300% increase in that time period. Okay, let's see here. So I do want to get to that third bullet to the last. the Chicano professional class develops. So that's one of the things. I mean, if Jorge alluded to our museum, it's a beautiful museum, and I'll give you some more information in a moment. But one of the things I'll mention right now is that in our museum, we pay a tremendous amount of homage to our agriculture background, to our origins in the state. We were drawn to Washington because of agriculture. There is no way around that, right? And we're very proud of that because many of us came out of there. Our CEO, Rogelio Riojas, was a migrant child. Back in the 1950s. I was a migrant child back in the 1970s, 1980s. So a lot of us came out of that background. We're very proud of it. But we were also very fortunate that we were able to break that cycle of poverty, right, and become part of the professional class here in the state of Washington. So in our museum then, we also pay a lot of attention to that because in our museum, the general idea is to not only showcase our struggles that we had here in Washington, but also our successes. Right, so we can take it to the micro level and look at people like myself or Rogelio Riojas and many others, but we can also take it at the macro level and look at the fantastic organizations that were created. CMAR just being one of them here in Washington. Okay, next slide, Lenny. So then that brings us to the end here of my presentation with this. I think I have one more slide, but this is getting pretty close. So then one of the beauties of our history as Chicanos in the United States and Washington is that when you look at our history, it is not much different from African American history, Asian American history, Native American history, because all of us, all those groups have one thing in common, is that we were oppressed groups, we were victimized groups. But the beauty of all those four groups is our resiliency, right, and our ability not to succumb to our victimization, but to rise above it. Right, through this idea of resistance. And so when you look at Chicano history, whether you're talking about the 1870s, the 1970s, or today, that is a commonality running through the history of the Chicano Latino community. Is because if we had not been resilient, if we not had resisted our oppression, we would not be where we are today. Right, and so this idea of resisting your oppression and victimization was critical to our development as a community here in Washington and at the national level. And one of those examples of oppression that victimized us but did not overcome us is the racialization of our group. And the term Mexican, I was talking about this the other day in another group. The very term Mexican was racialized by white dominant society, right? And that's why this term Mexican not only kind of disappears from the history books in the early part of the 20th century, but nobody who's Mexican wants to be called a Mexican because of the racialization, right? And it really denoted, from white society that if you were a Mexican, you were inferior, right? So people began to move away from that and take on terms like, no, I'm not Mexican, I'm a Latin American, or I'm Spanish American, or I'm Hispano, right? But it's due through this racialization process that is still with us today, unfortunately. Right, but now we got the tools, we got the mechanisms now to deal with this, to fight it, and try to make it disappear. Right, and then as I mentioned at the very beginning, many of us are very, very proud of our indigenous past. The Chicano movement was critical in resurrecting that. Right, so before the Chicano movement in the 1960s, a lot of people wanted to forget their indigenous past within the Chicano Latino community. Right, and there's a variety of different reasons. Right, but all you have to look at, and most people should know this history, is that when you look at the nation states of Mexico and the United States, they treated Native Americans exactly the same, right? If they did not want to assimilate, then you got rid of them. And what I mean by that is genocide. So Mexico committed genocide against indigenous people, so did the United States. And unfortunately, we're seeing one of those examples. It's very, very sad, and it's a huge tragedy, are the boarding schools that were created through what we call forced assimilation for Native Americans. And now, of course, it's just coming to light that a lot of the children that were sent there died or were killed. And we're now just barely uncovering their unmarked grave sites throughout the United States. So that's part of that history that, to be quite honest, mainstream America, they don't want to know that history. They want to hide it from the past because they had this very romanticized version of the United States. Rather than coming out and telling the truth and reconciling with it, right? We want to lie about our past. We want to lie about our history and keep it hidden. There will never be a reconciliation in this country if we do that, right? So we got to tell the truth about our history, whether we're talking about African Americans or slavery or the Asian American position or the indigenous position or the Chicano, Latino position in the United States, because unfortunately we have, these dark chapters in common with the United States. And the good thing is that some of this is being uncovered, and I'm hoping that it moves us forward. So in the end, then, when we look at our culture here in the United States, it's a combination of all this I got listed under: assimilation, acculturation, and a constant change. There's this fluidity in regards to Chicano Latino culture today. We still speak Spanish, but then there's no doubt that some of us don't speak Spanish, right? Because of assimilation, so our culture has changed. Some of us still listen to traditional Mexican music, like corridos and conjuntos. Other Chicano Latinos, we listen to rap, whether it's Chicano rap, Latino rap, or mainstream African-American rap. So these are the changes in constant fluidity that we're talking about. Spirituality, I mean, that's, I could spend, getting back to my college days, I could spend a whole semester just talking about spirituality. But understand that it's also a very complex situation within the Chicano Latino experience, whether we're talking about during the time period of indigenous history, or the intersectionality between indigenous religion and Christianity, right? And at first contact, we're talking about Catholicism, because Spain was a Catholic nation, still is. And then the changes in regards to religiosity and spirituality as we move forward in time to the contemporary period. But I will give you this one statistic. In the 20th century, you could easily, without being off too much, say that at least 90% of all Latinos practice Catholicism in the 1970s, probably even the 1980s. Today, you can no longer say that, because this is that constant change that I'm talking about. Today, Latinos who practice Catholicism has probably dropped to around 60%, 65%, because of the movement of people leaving the church and joining other denominations, primarily Protestant denominations throughout the country, right? Some developing a different form of spirituality that has nothing to do with Christianity. And so that's why we see this dramatic change in the last 30 or 40 years in regards to religiosity. And again, that's just tip of the iceberg in regards to a discussion that we could have on this. And then the impact on the United States, a variety of different levels, right? From our culture that's been picked up, to our architecture that's been picked up throughout the United States, to our food. I mean, who doesn't love tacos and salsa? I mean, I don't know anybody that fits that category, right? So yeah, in some ways, those kind of superficial examples, but it's also about the longevity of our culture that's been here in the United States. Okay. The next slide, and I think this is the last slide that I have. And of course, I wanted to show this slide on the left. This Dare to Dream. It's actually a mural that was painted by Chicano Latino students at the Washington State University Medical School about 2 summers ago. I was involved with this program. I still am. It happens during the summer. And with an artist, the students created what you're looking at. It's beautiful. Because not only do these kids who are going to go on to become medical doctors remember who they are and their origins, but they also see the future as themselves as medical doctors. And what beautiful way then to show that in a mural, right? And so I just fell in love with this mural, and I try to show it as much as I can to audiences, because it really kind of shows you the where we've come, right? Since we joined here Washington State, right? And then of course there's no other better example than the image on our right, which is our museum that opened up in October of 2019. And unfortunately, we were only open for 4 months before we had to shut down because of the pandemic. But we have reopened, right? So we are open for business again. Please visit our website, seymourmuseum.org, and you'll get all the good information. And then, of course, that quote I have up there is my favorite quote from Cesar Chavez. It's so powerful and so true in regards to the role that education has played in creating who we are today as Chicano Latinos in the United States. That our museum depicts us, and rightly so, as agricultural workers, because that's why we came here. But we don't want people walking away from our museum just seeing us as agricultural workers, right? So that's why we have our success stories, and that's why we highlight the role that education has played in the development of our community here in Washington. But to bring it straight to home, and Jorge mentioned this, the development of CMAR Community Health Centers. If it hadn't been education, CMAR would not exist today, right? So thank you very much for listening. Thank you, Lenny, for the invitation. Jorge, thank you for that very powerful lead in. I really appreciate it. And I hope everybody walks away with something about our community today.
All right. Wow. Very powerful and a lot to contemplate there. Thank you for all the knowledge, Dr. Garcia. We appreciate your time and your passion for history. And I'm so glad to hear the museum is open. Let me open up your microphone, Jorge, and yours should still be open there, Dr. Garcia. Okay. Well, I wanna invite Pamela back to the stage because I believe there's a comment in there that came through. What was it that what folks are saying?
Yeah, so there is a comment that says, CIMAR is awesome. Although I didn't take advantage of it, I think CIMAR was the first clinic I knew about that provided COVID-19 vaccinations on a walk-in basis. It's so important.
Right. That's an excellent point. I mean, and Jorge provided a statistic. I mean, we've provided nearly 250,000 vaccinations to the community. And I want to mention this because Jorge also alluded to it. On September 13th at our museum, we're going to have the Seattle Sounders and Santos Laguna Football Club from Mexico at our museum for a vaccination rally. The first 100 people to get vaccinated will receive $100 from CIMAR. You'll get 2 tickets to the Seattle Sounders Santos Laguna match the next day, and you'll be eligible for a shirt signed by both teams, right? Separate shirts, but both teams will sign those shirts. And we're going to be giving 1 shirt away from each team for the entirety of Hispanic Heritage Month.
Jerry Garcia was saying that many things have changed in terms of Catholicism of Latinos, and many other denominations now are important players in this field. But one very important is soccer. Soccer is part of the Latinos' DNA. And now we will have a match of 2 very important teams. The green team, the Sounders, is in the left side of my heart, and Santos Laguna, who is in the right. So it will be a very important match, and we will take that opportunity. We'll take advantage of this match in order to convince people to come and get the vaccine. That is our goal today. We need to vaccine all potential Latinos in the state of Washington, and we are trying to do many things. Soccer perhaps is a good avenue to reach them.
Yes, football. Yeah, being growing up in the Soviet Union, that's all we ever thought about. We weren't all that good about it, but we're getting better now. With the Sounders, though, that's such an amazing opportunity, and I am just like, what an amazing way to get people engaged through using the medium of football, which is so international and so loved around the world. And you back in 2019, when the Sounders won the cup, as the picture depicts right here, we had our first annual age-friendly day at the Sounders, which was supported by ARP Washington. And on the first ever, we still had 350 people show up, which was really cool. And we're like, oh, in 2020, we're gonna go up to 500. And of course, 2020, there were no fans in the stands.
Right.
So we really look forward to, probably not this year, but I'm glad that you are carrying that banner now to with that. That's a semifinal game, right? If
correct,
whoever wins is going to go to Vegas and play for silverware. So it's kind of a big deal. So I hope people show up and we'll share information about it for sure. And thank you for mentioning that. I had no idea what was going on, and I am a pretty diehard fan here. Pamela,
besides soccer,
yeah,
$100 is not a bad deal.
Oh yeah, totally. And signed jersey is great, but $100 in your pocket. My mom and I came here as former refugees. All we had was $100 in our pocket. So it's a huge deal. I mean, thinking back to those days, I'll take it any day. So thank you so much for doing that.
And then I want to emphasize, you have to get the vaccine to get those $100.
Oh, yes.
And just show up for it, huh?
That's right. You can't just show up. You got to get the vaccine.
Gotcha. Cool. Well, thank you for sharing that that opportunity and that important action. Pamela, do we have another comment in there? I think.
Yes, we do have one more comment, and I think this is directed to Dr. Garcia, but it says, I really appreciate the history you shared, fascinated, and I love the art. Thank you.
Excellent. Yeah, it's beautiful art. Especially, I mean, I've come across different pieces like this in my past where children or youth have created art, and it's just so powerful. I mean, when you look at it, I was involved with a piece of art made out of ceramic tile. It was just so powerful because children from the ages of roughly 8 to 10 created it, and it was just so beautiful. And just knowing that children created it gave it a different aura. So it's beautiful.
That's really awesome. And by the way, to those of you who are joining us online, I have on this final slide just the contact us information, cmar.org/contact-us.html. And I believe that's how you can get in touch with CMAR. And there's a customer service phone number, which is 855-289-4503. And just, cmar.org will probably have a lot of that information that was mentioned today and much, much more. So is there anything else that's coming through in our Q&A right now? As I'm looking over at my moderators.
I don't see anything else. Yes.
Okay. All right. Well, Pamela, thank you so much for being our guest moderator today and for asking our first ever question in Spanish and then translating it too. Yay! Thank you so much. We love it, and hopefully, if everything worked, there were captions there. I'm not sure when you all spoke in Spanish what the captions looked like. They probably were still in English and they made no sense. We'll try to fix that in post-production when we put it on YouTube. And speaking of YouTube, if there's questions that come in after we're off the air right now, we'll capture them. And once this is uploaded on our YouTube channel, which is, by the way, at Aging King County, if you haven't already, please consider subscribing. We do appreciate that support at Age Friendly Seattle. We will add those questions to the comments under the video, and we'll let you know, Dr. Garcia and Jorge, to respond. So we'll do it that way. And with that, I want to thank you. Thank you for being here, and thank you for talking to us about all the important work that you do and about the community you serve and all the and how rich and interesting the history is in different ways, and sharing that through art, and so it's so visual and so visceral in how that shows up. I think we should share this with our friends at the arts department here at the city. I think if you're not working with them already, we probably are.
Absolutely.
So
absolutely.
Very cool. Thank you for being here. I'm gonna move us along since we are about 9 minutes over time anyway. Take care, Jorge and Dr. Garcia.
Thank you, Lenny, very much for giving us a platform.
Thank you.
Yeah, absolutely. Yeah. Okay, and Pamela, thank you again. So
Pamela, thank you very much.
Thank you so much.
Okay. Bye-bye.
Bye-bye.
So with that, I want to show one more slide. It's all about slides. When you hear government talking, but we're trying to provide as much information. We talked about being age-friendly. Age-friendly is about livability, and there's various domains about it, right? One thing is certainly social and civic participation. That's what we're trying to do here. But then there's also, providing information and housing and transportation. And how things are in Seattle's neighborhoods. So Department of Neighborhoods will be here in 2 weeks, which is September, we add 14th, September 16th. Also Thursday, also 10:30 a.m. Everything is the same. But then we want you to save the date For October 7th, that's the first Thursday of the month, then we'll have another close to home event. If you want to find out who the speaker is, we invite you to just go to the same link that you went to join today, and you'll click the calendar button and see who we have coming up. Thank you so much for joining again. The organization that you heard about today, CMAR, is a member of Community Living Connections, which is a network of organizations in Seattle and King County that can offer support and resources. Their phone number is 844-348-5464, and you can look it up online at communitylivingconnections.org. With that, I want to say goodbye, adios, and do svidaniya, which is, I always say that, but today I'm adding to my toolbox a little bit. Didn't look like we had any more questions there for the library. So Nancy, thank you so much for your partnership and for being here today. We'll see you in a couple of weeks. With that, I want to wish everybody a good Thursday afternoon. Please be safe out there, and we'll see you next time. Take care, everybody.